Millions of pilgrims gather on banks of Ganges despite surging COVID infections. Experts warns of inadequate preparations as one of the largest religious festivals in the world takes place in India in the middle of a surging second wave, with the number of COVID cases hitting more than 150,000 a day. Millions of Indian pilgrims are gathering at Kumbh Mela, one of the biggest religious festivals in the world. Around 1 million people a day will take a ritual dip in the Ganges this month, with a total expected to hit 30 to 50 million by the end of April. On Monday, a particularly auspicious day, more than 5 million bathed in the holy river, with crowds seen surging on the banks in limited social distancing. Kumbh Mela, or the Pitcher Fair, is not just a religious pilgrimage, but one of the largest peaceful gatherings at one place in the world. The spiritual fair is held 4 times over 12 years at 4 different religious sites: Haridwar, Prayagraj, Nashik, and Ujjain. This year's festival in Haridwar in the state of Uttarakhand marks the completion of an 11-year cycle, and is referred to as the Mahakumbh or the Super Kumbh. During the previous Kumbh in Haridwar in 2010, more than 10 million pilgrims took a dip at one site on 14th of April alone. At another Kumbh Mela held in Prayagraj, 240 million attended. These are staggering numbers at any time, but in the face of a raging COVID pandemic with India now the second hardest hit country in the world, there are major concerns about the event's safety, with many health experts calling for it to be cancelled. In the first week of the gathering, 7 Hindu seers along with 300 pilgrims tested positive for COVID in the Kumbh site. The infection rate rose as the first pilgrims arrived in the state last month, increasing from 0.67% on March 23 to 1.33% by April 1, and a further 1.93% by April 11. In the face of a steady influx of people and a rising infection rate, observers have warned the preparations are inadequate, even as massive state resources are being diverted to the festival. A report by the Uttarakhand High Court warned of a lack of hand sanitizing stations, a shortage of changing rooms and bathrooms, inadequate drinking water facilities and a shortage of testing kiosks. The report also warned of the poor condition of hospitals on the site area with dirty toilets and bathrooms. Mr. Naudiyal, whose foundation has been tracking the COVID pandemic in the state over the last year, is also worried about the diversion of healthcare staff from other parts of the state towards Kumbh. The state is already facing a shortage of staff, and this diversion of resources may further affect healthcare in other areas, he says. The Kumbh administration insists it is well prepared. Dr. Arjun Sengar, the chief medical officer, says doctors have been called in from other districts, and even from other states, and efforts are underway to provide 100,000 rapid antigen tests and 30,000 PCR tests a day. In total, we have over 10,000 beds, including over 70 ICU beds and ventilators to provide COVID or non-COVID care. We also plan to test all devotees after each of the Shahi Snans, special dips, on April 12th, 14th, and 27th, he says. He concedes, however, that the positivity rate is increasing by the day. On March 24, the Uttarakhand High Court ordered that only those with a negative COVID test should enter the site, but by this point hundreds of thousands of pilgrims had already arrived and were camping in the area. One key area of concern are the Nagasadhus, Hindu ascetics who have renounced the world and live without any possessions. Ash-smeared, dreadlocked and naked, these holy men are believed to be able to counteract the world's bad karma with their holy practices, and are highly revered. Digambar Raghavgiri, an Nagasadhu who has traveled from his cave in central India's Madhya Pradesh, has not been tested for COVID or been vaccinated but is clearly unhappy with the COVID protocols demanded by organizers. Like him, hundreds of Nagasadhus have set up tents in a large campsite, waiting for the pilgrims. India's deep ties to religion and its belief in the power of God above all else is perfectly summed up by a maskless Bubba Ragdan and a Hindu seer. If COVID has to happen, it will happen anywhere. It is God's wish. We are here to pay our respects to our God, and He will take care of us, he says.